All right. Good morning, everyone. No disclosures. This ancient book from 2006 still has relevance in terms of basic how to do it. I have not updated this book. I don't foresee doing so. And I don't take any royalties from anything. So we're going to talk about how to think to be safer, how to pick your candidates more correctly, design elements. We're not going to get too much into technique for this lecture. I have a lot of lectures I talk about technique, and they're posted on YouTube if you want to review them. This is a new lecture, just sort of going through the thought process. So who is a candidate for fat grafting? Well, there is a full spectrum. As you know, a lot of people don't want surgery. And I've had from a lot of fat grafting to less fat grafting now to more again, and they go in trends. So some people just simply don't want a surgery, and those are the people that I'm going to be doing fillers on, for example, and then oftentimes they convert into a facelift or a fat transfer later on, and then I continue them with some fillers thereafter. So there's this full spectrum but the thing that I try to emphasize is that certain things that simply don't work, like thread lifts or other things, or Kybella in the neck, in my opinion, I don't offer. So I just try to get them to understand things that are efficacious. So the spectrum, fillers really for me are great for all ages, but for the younger that don't need fat grafting or may not be safe, and we'll talk about what that means, and don't need a lift, are the people that I'm working on in youth. And then as they get older, they have probably more global volume loss that would justify a benefit of having fat transfer. And then when gravity starts to set in, there's some kind of lifting involved. So this is what I go through when I talk to a patient in the preoperative setting. One is just the emotion. Some people simply don't want surgery, and you can sit there and talk to them forever and they're not going to do it, and that's fine. Sometimes they're just brand new to the whole field, so just doing a small procedure like some fillers can initiate them into this whole world and then make them more comfortable and possibly transition them over. Cost, surgical procedures are more expensive, and doing fillers are a lot easier in terms of cost. They can buy as they go, so to speak. Recovery, with fat grafting, there's simply more distortion for that week to sometimes 2 weeks or beyond. Age, to me this is a huge thing, because fat, and you'll hear me say this repeatedly in this lecture, is not a bioinert substance, it's not a filler. It can change with weight. And when someone is very young, I'm very cautious in placing fat in them because I don't know their long-term changes. It's the same thing with hair restoration. If someone comes in and they're 20 years old and wants an aggressive hairline, first of all, I may not even operate on them because they're too young, because I don't know how they're going to lose hair over their lifetime. And that's important. Weight is the most critical question I ask, is what is your weight history? If they say they've lost significant weight and then repeatedly gained it, if I'm going to do it on them, I actually will do it when they're heavier, not when they're lighter, because I almost will guess that they're going to regain weight. I live in Texas. This is where the land of the big, and it's not just big beef, but that's the reason why people are big there. So it's weight. I want to make sure that they're a safe profile before I consider doing it, because the weight fluctuations are important. And if they are very petite and I do a procedure for them, they could look too full, even with a small modest weight gain, like if they're 90 pounds. But if they're 90 pounds, they usually don't gain that much weight to begin with. And then other surgery. If I'm doing a transconjugal blepharoplasty or a facelift or some other procedure, then I have a lower threshold to do fat because it's just there and it's easy to, there's not as much of a ramp up because they're doing something else. So that's another thing I'm looking at. Skip global, and what global means is something I've alluded to here, which is if they really have enough volume loss to justify it, great. If they have this little thing here, I find that because fat has some level of variable resorption, it's hard to predict 100% where it's going to lie, that if they just have a minor small correction, I usually really encourage them to do fillers. If they have a global volume loss, and from a cost benefit ratio, recovery benefit ratio, it makes sense to do it. So I'm a redundant lecturer. I say the same thing over and over because it's the only way people can learn. Fat is bioactive. Do not treat it like a hyaluronic acid. It does change with weight, and it is permanent. Some people I've heard, oh, it's just scar tissue that's built up. No, it is there. I had a lady that I do a lot of surgical corrections for lips, and I opened this lip and I said, you had fat transfer? And she said, no, I didn't. I said, you never had a fat graft? She says, yeah, but they didn't do my lips. I said, yes, they did. I see the fat 10 years later. Fat is there. It is absolutely there. It is not some kind of collagen rebuilding. So you must think permanence. And with that permanence, you have a high degree of responsibility for this patient. The other lesson, and if you guys have not had the chance to work with me in the lab with the lower eyelid fillers for fat, I would love for you to teach you, because I think that is the area that's people screw up. And the rest of the face is pretty darn easy, to be frank with you. It's the lower eyelid. The lower eyelid is easy, but I've watched you guys do it, and it's so important in this lab. It's simulated almost 100%. To what a real fat graft will be like, and I will walk you through it if you have the time this afternoon to work with me on this. So it is safe. You just got to follow some basic guidelines, and you can do it. So again, I encourage you to work with me today. For me, I've really shied away from the anterior cheek. I've found that if you fill the lower eyelid and fill around the periphery and not the anterior cheek, they still get a cheek enhancement. And I find that fat retains too well in the anterior cheek, and sometimes even modest weight gain it may not look so good. So now I honestly don't put anything in the anterior cheek, or rarely put anything. Even 1 or 2 cc's in the past seem to be overfilled in my hands. So I'm very cautious with anterior cheek, and it still looks amazing on these patients, and I can always add a little filler if I need to. Yes, there are some stem cell changes that are beautiful with fat that I see over many, many years, but to be very frank with you, I try to take away the marketing words like stem cell facelift or stem cell this, or I don't do nano fat, so I think the jury's out on how much improvement that can have. But at the end of the lecture, I'll tell you some things that are pretty cool that I think are very similar to nano fat. Single session. I only do 1 session. I believe that it is problematic to do multiple sessions because you can easily overfill a face, because fat is a very soft, pliable product that has some variable resorption. So if you try to use it like a filler, you can overfill a face. So I'm really into this, treating it like what I call a mattress, a foundation for the face, not just trying to blow up the face with fat. I believe, and I tell my patients this, and I always say the difference between an education and an excuse, and education is told beforehand, excuse is afterwards, is that fat needs a touch-up. It may need a little filler, because the reason I say this is not that they don't look good after a fat transfer, but they come back a year later and they go, you know, there's this little area I didn't quite get good enough, and I already told them, look, you just need a little bit of a filler. And also, over time, that filler lasts. So the dirty secret is that fillers do last. And I've seen it last, I would say permanently, minus further aging, and they do get older. And so people that do a fat transfer a year or 2 later, I just manage them with a little bit of filler, and it takes so little to touch it up after a fat transfer. The other lesson I have is, because fat is soft, it is not great for surface flaws. So when people are trying to treat acne scars, treat little defects in the skin, good luck. Very hard to treat it because it's not hard product. It just doesn't do well, and it resorbs a little bit, so it's very hard. So when you're using fat for a global enhancement, I think people look great, and if you set up the expectations that fat is meant to contour and soften the face, it's beautiful. But if it's used to try to make one area of the face perfect, I think it is very difficult. As I told you, I've gone from up and down from more fat to fillers, and I'm doing a lot more fat now again, but fillers are my mainstay. It's great for someone 20-some, and it's great for someone 80-some. So I use a lot of fillers, and I think, for me, if you think about it, you see all these great surgeries, and then the fillers look horrible. And so I jokingly tell my patients that I'm like Apple. I control the end-to-end user experience. I want to be able to do everything for you, from the surgery to the filler, so that everything looks seamless. Otherwise, you hand it over to someone, I think there can be, unless you have someone you trust, but I really think my aesthetic eye is, I like what I see, what I do, and so I like to control the whole spectrum. Facial shaping is critical. What I would try to do is take women away from looking at themselves microscopically and seeing small flaws, because I'll never fix them. I'm talking about the instant feeling when you see a face. What is that? And so facial shape is critical. So I'm going to talk a little bit about facial shape, both non-surgically and surgically. So this oval shape in the 30 is what women prefer. So what is baby fat? All it is a linear loss of fat from birth to death. Think of a 1-year-old, a 5-year-old, a 10, a 15 as progressive volume loss. If the weight is stable, a 80-year-old looks volumetrically depleted compared to a 20-year-old, and a 40-year-old in between has a different volume shape. Of course, gravity begins to become more prominent in our 50s and 60s and beyond, and that's when lifting procedures could help. This is taken from Bill Little. He talks about the shape, and I really think I want to emphasize the upper face. So how do I do that? So this is a schematic here of breaking it down into the various parts of the face. Now, for the upper face, I use fillers and fat, and if I'm in the outer face, if I'm not going to do fillers or fat, I'm going to do a lift in that area. And you want to reduce the lower face. How do you do this? Well, what I do is mesenteric Botox if I need to, and I'm talking a little bit more about that from a design perspective, or sometimes together with a lift. The Kybella I just mentioned, I don't like it for necks. I use it for really two purposes in my office. One is jowl reduction. I think it's great if someone's not going to do a surgical procedure. Very little recovery, very painless if you mix it with a little bit of lidocaine. Very short recovery, and I do use it for non-surgical lipoma reductions. Beyond that, I don't find a lot of indication for it. So let's talk about facial shape. There's all different types of facial shape, but if you boil it down and you break it into the upper portion, the lower portion, if you look at the upper portion, even though I just told you that I do like putting a little volume around the temple and around the eyes, there is not a big difference between these facial shapes. I heard this lecture in June, and it's just an amazing concept that the lower face is really what contributes to shape. And so when you have that broader outer face, it can make the face not look as feminine, softer, youthful, heavier set. And this is a lady that's actually gained 10 pounds, but she looks thinner because of judicious fillers and Botox masseter reduction. This is a lady I did a facelift, but I also did a masseter reduction to shrink that outer flare. This is just simple Kybella, one vial into the jowls. It doesn't make it perfect, it is not equal to a facelift, but it just helps reduce some of the bulk of that lower face with very, very minimal recovery times. Shaping the face with fat, you can make the face look a little bit less hanging. You heard from Tim yesterday and saw some beautiful results that he's done. And you can see putting nothing in the anterior cheek still looks good, in my opinion. There's a lady that looks very bottom heavy. She's had aggressive eyelid and nose and other surgeries back in her early 50s. She's now 12 years later in the right with volume fillers and just to reshape the face and reconstitute the eyes. A lady that I've done a lot of things from fillers, fat grafting, rhinoplasty, facelift, lasers, etc., just reshaping the face toward a more youthful shape. This is a lady just fillers in her mid-30s on the left versus mid-40s on the right, just slowly enhancing her just with volume. So let's talk about the next subject, which is facial framing. What does this mean? So again, I love schematics because basically a frame, I do a lot of hair restoration and chin augmentation, so I talk about those as being frames. But what is the most important frame? To me, the most important frame are the eyes. Why? Because we communicate with people's eyes. A lot of women are bothered by their mouth. They come in, they say, you see this fine line around my mouth, and I have to discourage that because first, I may never get that good enough, and second of all, when you're connecting on a social, professional level with a human being, you are engaging with their eyes. And so I try to help them understand this. So to give you the understanding, I talk about a schematic of thinking about the circle. So let's break it down further in terms of what I would like to say. So I like to talk about an asymmetric triangle. For those people that were in lab with me yesterday, you've heard about this. And what this means simply is a schematic saying that A-frame deformity or that inner brow is very important to fill. If you fill it and gently contour it, it actually takes what looks like a droopy eyelid and converts it into a beautifully framed eye. It's counterintuitive. But if you just frame that in, it looks beautiful. And the lateral brow, which used to be my focus, it can actually make that area look more compressed and heavy. I do put filler or fat in the outer brow, and I think it's critical to do it to create a balanced outcome. But I first start by setting that inner brow. And after I've set that inner brow frame, then I fill the outside. And I focus, when I do the outer brow, the transition across into the lateral canthus, because if you don't transition it into the outer canthus, it looks like a distinct mound, and it can actually make the brow look heavier. Well, how do you fill this? You fill it with fillers in a parallel fashion. I use cannulas. Now, I don't use needles for anything around the eyes, so this is if you're using needles, I can't educate you about how to do it because I have a certain way of doing things. I believe there's a higher safety, more accuracy, less bruising. I just love all cannulas around the eyes. So I go parallel in the way that you see with fillers, and with fat, I go perpendicular and I go deep. So it's a different way of approaching it, and so and if you're starting and you're trying to figure out how to do fat around the eyes, use hyaluronic acid the first time and do it as if you're doing fat. That way you can get the feel of the release of this arcus marginalis, you can feel the depth. Then if you mess up, you can easily dissolve it. So this is important, is approaching it this way. And sometimes I'll come back and just add a little bit of touch up in the canthus and just soften little areas, because as I mentioned, you heard me talk about during the pro section, a little volume on the outside. So with Asian eyelids, this is a very confusing topic. It's a whole different lecture, but a lot of times you'll see that they had a crease in youth and they start to lose it over time. A little bit of volume using hyaluronic acid can restore the shape of the eyelid. You don't necessarily have to do an eyelid procedure, and this is another example of just adding volume around the eyes. And I did take a little bit of skin. Now, I only take skin away and not do a formal Asian blepharoplasty in someone that has a pretty distinct fold. If they have almost no fold, I don't just take skin away, because you're not going to make a difference. You're going to leave a visible scar. So that subtlety, again, I encourage you to look at my YouTube video that's about 40 minutes long on this subject, but just to have you understand, volume is so powerful. That was done with fat grafting. This is done with fillers. So again, look at that asymmetric triangle. If you see this eye looking slightly tired, just look at that inner brow. Just filling that and rounding it out makes it not look sagging. I know it's extremely subtle, but that's what beauty is, and that's how we connect on a social professional level, as I alluded to. So this is a lady here that looks very saggy. In fact, if anything, she's raising her brows up to try to hold her brows up. I Botoxed out to bring it down, and then I volumized it. And where did I principally volumize it? In her medial brow. Medial inner brow that creates that beautiful shape there. So I'm going to conclude this with something that I call this the year of Botox or botulinum toxin, because I'm obsessed with thinking about the healing effects of botulinum toxin. And this is a lady that I've done one session, full facial meso-Botox treatments, and you can really see a better improvement in the dynamic lines and the static lines. And this is another example. Now, the caution you have with doing this dilute Botox, which I'll explain how I do it in a moment, it can affect the smile. So you look at this smile for about a month, it can look a little off. You know, it's something most people don't notice, but it goes away, and then the texture still stays, and that's what's really awesome. This is an example. I used to do more Sculptra PLLA, but this is a combination with the botulinum toxin, just a single session of botulinum toxin. And you can start to see improvements in necks with a single treatment. And the reason I emphasize this is that it really helps shape what we do surgically. Because if you think about it, when we do treatment surgically and we still can't manage these dynamic wrinkles, we still can't manage the texture in the neck, we can't laser the neck and chest with any degree of safety or awesomeness, just doing a little bit of micro treatments around the neck, chest, this is a 30-year-old chest, just cleans up the quality of skin, or the breast area is just an amazing adjunct to the treatment. I did this lady, I thought, she has recalcitrant acne, and I didn't know what to do with it, so I said, let's try a little of this dilute botulinum toxin, and in one session, it just cleared up everything. It's really quite amazing, because it starts to work. I can talk for hours on this one subject, but I'm trying to look at hypertrophic scarring. I'm looking at a lot of things, acne scarring with botulinum toxin. I have no idea if it works for these things. I'm working on it, because also in June I listened to a lecture that talked about how they did a split scar analysis of thyroid post-thyroidectomy, just 5 to 8 units on one side, and they found that in a double-blinded analysis with saline as a placebo, that the side that had the Botox looked amazing. So now I put this meso treatment in all my incision, well, not for facelifts and things like that, but for like scar revisions, all those kind of things. I put a little botulinum toxin about a week out. So the way I do it is I basically do a 4 cc dilution of the botulinum toxin, and then I drop about 0.3 cc's of that mixture, dilute it further down to 1 cc, and I'm using about 4 syringes in the face, intradermal injections, just about every centimeter across the whole face. In the neck, I use quite a bit. Sometimes I'm using a full bottle or a bottle and a half to do all the way into the breast, chest area, and it's very fast. This is a little bit more sensitive in a large area, so I sometimes use a little numbing cream or Pronox, breathable nitrous, which helps. But it is, to me, botulinum toxin is an amazing adjunct to what we do as surgeons, and I think it gives you that full 360 on ability to make a person look awesome, from stem to stern, from end to end, from small to big. A little plug for my hair course next year. I don't make any money on the course, but I'm very proud of it. This has been 10 years in the making. There's a brochure outside. Very intense hair course, so love for you guys to attend if you can. And with 20 seconds to spare here, I encourage you to really love what you do and not just be technicians, which is of course critical, but also to have passion for what you do, be an artist and thinking and rethinking this every day, constantly rethinking this, and learning from meetings. I've learned about 10 massive pearls in this meeting. As much as an educator as I am, I'm also a student. So always be a student. Thank you.